Let's turn now to Democratic Congressman Anthony Weiner of New York, who's been good enough to join us here. Good to see you, sir.
My pleasure.
Senator Reid can ask the Senate to vote for a bill with a public option or without. Neither right now has 60 votes supporting it. Why is he acting like the public option alone has to clear the 60-vote hurdle?
Well, it doesn't. All you need is 60 votes to allow the thing to be voted on the floor. Look, Senator Reid has to make a basic decision. Do we want majority rule or not? You know, an overwhelming majority of the country, a clear majority of the House and Senate want a public option. The question is, are we going to allow the minority to drive this train? And we shouldn't. You know, I did something interesting recently. I have a website, countdowntohealthcare.com, and we put on a pin map where the calls were coming from to get the public option. It's coast to coast. It's red districts. It's blue districts. This notion that somehow this is an ideological thing on the coast, that people want a choice and want lower costs in health care, is mythology. You know, I like Senator Reid. He has a difficult job. I grant that. But if we can't get 60 votes just to get it to a vote and then allow a majority to decide, I'm not sure we even deserve to be running the House and Senate.
The president's role in this is obviously just as difficult, if not difficult, than anybody else's. But why is he down in this poll, do you think, 15% among Democrats in terms of his position on health care?
Because he was elected, and a lot of us were elected, in part on a promise to do something important here on health care. And his seeming desire to kind of let this process be governed by Senator Snowe, who seems like a very nice senator, but I don't think we want to outsource it to her. You know, I think that the moment the president puts his finger on the scale for the public option, people start remembering why they voted for him, and we'll rally to that cause, and I think senators will, members of the House and Senate will, and the public will even more so. Remember, we're at 57%, even without the president, with a full-throated way embracing it and going around the country rallying support for it.
The White House point seems to be about this and about his position, that this is the year we start health care reform seriously in this country, that anything that says health care and insurance are rights, not privileges, is a historic victory and a changing of society, that there's too much look at the trees and not enough forest imagery. Is he right about that, or is the White House right about that?
He is wrong in a fundamental way. We only get one crack at this for the next 10, 15 years. We as Democrats, we control the House, the Senate, the White House. If we don't get this right and we don't bend the cost curve down and we don't show that people are going to stop losing their insurance, we don't show that we listen to those people who sign up at websites and who voted for President Obama and the Democratic Congress, I don't know if we're going to get a second crack at it. We were successful with Medicare 44 years ago because we did it right. And we did it over the objections of Republicans that called it socialism. We did it over the objections of people that said, oh my God, you're nationalizing this industry. We did it right, and now 151 of my colleagues have Medicare, a single-payer health care plan that they don't seem to be complaining about. They have the public option. They seem not to want the rest of us to have it.
That poll, what does it do in terms of assessing, again, that question? I've asked you this at least 3 different times, if the House could pass a bill without a public option in it, when in this poll it is clear more people think health care reform, as currently constituted, does not go far enough than think it goes too far.
Yeah, look, we cannot pass a bill in the House without a strong public option. And why would we want to? When we see that at least 57, I think it's much more than that. When you describe it as being a plan similar to Medicare, it goes up over the 60 point. Why would we want to? This is something the president campaigned on over a very long campaign, something we've been talking about now for 6, 7, 8 months. Why would we want to leave the public option aside? There's only one reason I can think of, and that is to continue worshiping at the altar of Olympia Snowe. And again, that's fine, but that's only one vote, and frankly, we're Democrats. We were elected to take care of this problem. We should just go do it.
Congressman Anthony Weiner of New York, as always, great thanks for your time, especially coming in.
Appreciate it.